As our coverage of Oral Cancer Awareness Month continues, we're joined by a special guest today. Hi, I'm Allie Cook. Today's April 13th, 2016, and this is your Wednesday Watch.
Now, oral cancer globally affects about 500,000 people, and of those, about 150,000 people die annually from oral cancer. We have been very fortunate to have an unrestricted educational grant from Henry Schein Cares Foundation, and that has allowed us to put together the program for the forum. And the purpose of the forum is not to solve the problems of oral cancer overnight, but more to expose all of the attendees to the different ideas, different programs that are going on around the world so that they can bring something back to their organization, to their workplace. This forum will bring in all of the stakeholders with an interest in oral cancer.
Here's today's dental news brought to you by the Henry Schein Cares Foundation. Jojo, the golden retriever, is helping relax nervous children at a dental practice in Northbrook, Illinois. Jojo is a trained comfort dog, and her handler, who is a dental assistant, had the idea to bring her in once a month. They've had excellent results so far. One youngster had been so fearful that she couldn't be treated without general anesthesia. Thanks to Jojo, that's no longer the case. Nervous parents relax around Jojo too, sitting with her while their kids get their dental work done. Jojo also works at nursing homes, facilities for disabled adults, and was even there to lend comfort after the 2012 school shootings at Sandy Hook Elementary in Connecticut. Continuing our coverage of the Global Oral Cancer Forum, here's my conversation with Dr. Michael Alfano, Executive Vice President Emeritus of New York University and this year's recipient of Oral Health America's Tribute Award.
And tell us why this event is so important today.
Well, for quite some time, I have been concerned that the dental profession is really not doing a good enough job in diagnosing oral cancer early enough. It goes back to a paper by Alice Horowitz about 18 years ago in which she asked dentists if they do oral cancer exams, and she got an answer in the mid-90s. And then she proceeded to describe an oral cancer exam to their patients, and only 7% of that patient population had ever had that particular examination performed on them. And the telling sign is, if you ask a person, does your dentist ever grasp your tongue and move it from side to side? And the answer is no. That means most likely they have not done a thorough oral cancer exam. So because this disease does not get managed well, doesn't get treated well, there's not good treatments in the later stages, it's very important to get the oral health community to focus on oral diagnosis sooner so we can pick these lesions up when they can be excised locally with no bad outcomes. When we catch the disease later, when it's spread either regionally or systemically, the management is much more difficult and the survival rates go down precipitously.
Dramatically,
Dramatically,
right?
yes.
Yeah. Well, I understand you are no stranger to oral health. We were in Chicago earlier this year. You were honored at the Oral Health America Gala. Can you tell us a little bit about that? I'll let you brag a little bit.
Oh, well, it was a very nice honor. It was quite unexpected, as the best honors often are. And it was great to be there with the Chicago Dental Society and some colleagues from the corporate world. So Henry Schein, the sponsor of this event, was there. Dentsply Sirona, just merged, a recent company, was there in large numbers. That was special for me because I'm on the board of Dentsply Sirona. And also very special to me was the fact that the Santa Fe Group, a not-for-profit that was founded about 20 years ago, was also there in force. So I got to acknowledge my colleagues from each of those entities, and it's been a joy to work with them. So as I said to my spouse, I feel like I'm leading a charmed life these days. I get honors, I get asked to give keynote addresses, and I get to be around really talented people with great passion for improving health and oral health in particular. So it was a special event, and it's a very nice honor.
That's great. We're glad to have you. Real quick before we let you go, I know you're a busy person. What do dentists need to know? What's the main takeaway of today's event?
So it's early into the meeting, so I wouldn't want to judge too much what's going to happen next. But there are some early themes. One I've already talked about, which is the desperate need to get more dentists engaged in early diagnosis, and for that matter, to get more people looking into their own mouths, patients to look into their own mouths, to look for strange things or changes in their mouth. So that's one theme. Another theme that occurred later in the morning was the fact that for too much of the world, the data set available on oral cancer incidence and mortality is broken or unavailable. And so we don't have good data. And as any person in business will tell you, if you can't measure something, you can't improve it. You have no basis to know that it's getting better.
Exactly.
So somehow, some way, maybe with some help from WHO, maybe the Gates Foundation will step up and start to pay to establish these registries around the world, particularly in the poorer countries that struggle to gather that kind of information.
Well, thank you so much for joining us today, Dr. Alfano, and congratulations on all the honors that you've been given lately.
Thank you so much. Appreciate talking to you.
Thank you.
Bye-bye.
Thanks, Dr. Alfano, and thank you for joining us for the Wednesday Watch. Stay tuned next week for more of our special coverage.